Back now on Try Today. This is National Hospice Month, so it's appropriate we have our good friend with us who can talk about hospice, help us understand more about it. With me right now, Dr. Michael Lalor is Chief Medical Officer for Trellis Supportive Care. Good to have you back.
Good morning, Jim. Thanks for having me back. Pleasure.
Since pandemic is sort of at first and foremost in people's mind, let's start there. I'm assuming that Trellis has continued its supportive care throughout the pandemic, right?
Correct, yeah. So, for 40 years, we've had the privilege of taking care of people in this community. And you don't make it that long without overcoming a hurdle or two. So
Right.
This was another thing for us to address.
Able to keep staff, family, patients safe?
Correct. We effectively balanced safety of all the individuals we had to provide for and the service that we're so well known for.
Now let's talk about, I mentioned National Hospice Month. Let's remind folks, A, what hospice is, and B, when the right time it is to call on behalf of a family member or loved one. So that's sort of a two-part thing.
Yeah, so hospice is a very specialized level of care that focuses on the quality of somebody's life, regardless of the quantity remaining. We provide interdisciplinary support to really ensure that they have the ability to live at the end of their life. And then, in regards to the right time to call, it's so hard to really know. What we always suggest is if there's any questions, if you need clarity, give us a call. We'll walk through it with you because there's so many other services we can provide in addition to hospice. So we'll help clarify it.
And I think, people also, it's important to note that most of them, I don't know what the exact percentage is, not to put you on the spot, but most people who are under hospice care are under care in their own homes. And your team will go and help them, whether it's a nurse or a chaplain or anybody else, right? So it's done in the home, and people should know that.
Correct. And at this point in time, I think we see the highlighted importance of care in the person's own home and outside of a facility. Very common misconception that you have to go somewhere. The bulk of the care that we provide for about 550 patients a day is in their own house.
Right. And then you do have a small percentage where, for whatever reason, it's appropriate or their choice, that they do come to your facility. And you've already mentioned how you've kept that with staff and everybody safe during the pandemic. Now that leads me to this: if I'm thinking about, let's say I have a parent who might need to have hospice care, or has been diagnosed with a serious illness or a terminal illness, what are some of the things I need to be thinking about through my mind as I'm thinking about what kind of hospice facility or what kind of care, because it's going to be overwhelming for people?
Yeah, exactly correct. It's so hard to do this effectively in your own home by yourself. We can help provide that support and clarity of what's needed. There's so many contingencies to walk through on any individual case. We just help guide the journey.
If you're getting care and you're in your own home, again, the whole team is really with you on this, because a lot of people think, well, I have to be in a hospital or I have to be in a hospice facility, but your family is sort of working with your team, right?
That's exactly correct. Our nurses, case managers, social workers, chaplains, physicians if required, all come see you wherever you call home, whether that's a private residence or an assisted living or a nursing home.
Let's talk about the upcoming holidays, Thanksgiving, Christmas. Of course, there are some medical professionals say, let's don't have large gatherings, but let's assume that you do have a gathering at least with your elderly parent and maybe they've been diagnosed. Very quickly, before we run out of time, is that a good time to sit down and have a talk with the parent and say, let's meet with the folks at hospice?
Yeah, maybe at the end of the meal, not during the time of celebration, but you may notice something different, in speaking to them and say, hey, let's just reach out, see if there's something that they can do.
All right, up on screen, trellissupport.org is the website, which I hope you will visit. The number on screen, 768-3972. You can call for an appointment as well. Dr. Lalor, thanks for all you do and your team, and you have a great holiday.
Thank you, you too. Thanks for having me today.
All right. We'll be right back after this.